Hello and good evening. My name is Lisa Regina Wade, and I'm here today to discuss a health issue that plays a major role in public health today among many Americans, and especially African Americans. And it also hits close to home for me. And that health issue is diabetes, or in my culture, it's called sugar. Well, I have type 2 diabetes. So let me give you the medical definition for what diabetes is. Diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. When I was first diagnosed with diabetes, I went through several phases of trying to wrap my head around how did I get this? Where did it come from? How do I get rid of it? And most of all, what in the world am I going to eat now? Noting that I'm a picky eater. The main thing that I did was I went into a depression and denial phase. I can't have diabetes. What is this going to do for the way I eat? Because I have never been one to what you call eat right. And more so, am I going to die? I now know the answers to those questions, but at the time, it was all so overwhelming. So let's discuss some causes of diabetes and how it is caused. There are 3 different types of diabetes: type 1, type 2, and gestational. And each one has a different underlying cause. Here are a list of causes and risk factors. They include your family history, conditions of the pancreas that result in reduced insulin production, overweight, obesity, especially around the tummy area, physical inactivity, increased levels of blood cholesterol, high blood pressure, aging, low testosterone levels in men, ethnic background, and hormonal disturbances, and certain medications can also lead to an increased blood glucose levels. For me, there are a few of the causes and risks that could have caused me to get diabetes. So who does diabetes affect, and are there some people who are affected more so than others? Diabetes affects no certain person, but can affect anyone from any walk of life. There are some who are more susceptible to getting diabetes than others. The prevalence of diabetes, according to the American Diabetes Association, is in 2015, 30.3 million Americans, or 9.4% of the population, had diabetes. Approximately 1.25 million American children and adults have type 1 diabetes. Undiagnosed are 30.3 million adults with diabetes. 23.1 million were diagnosed and 7.2 million were undiagnosed. The prevalence in seniors is the percentage of Americans aged 65 and older remain high at 25.2%, or 12.0 million seniors are diagnosed or undiagnosed. There are 1.5 million Americans are diagnosed with diabetes every year. 84.1 million Americans aged 18 and older had prediabetes. And diabetes remains the 7th leading cause of death in the United States in 2015, with 79,535 death certificates listing it as the underlying cause of death, and a total of 252,806 death certificates listing diabetes as an underlying or contributing cause of death. Diabetes was the 7th leading cause of death in the United States in 2015, based on those numbers. In 2015, Diabetes also mentioned that as a cause of death, a total of 252,806 certificates. After adjusting for population, age, and sex differences, average medical expenditures among people with diagnosed diabetes was 2.3 times higher than what expenditures would be in the absence of diabetes. Now, what I want to take time out to discuss is diabetes in terms of behavior and environmental factors. One's behavior and/or environment may have caused their diabetes. I spoke earlier about not having so much healthy eating habits that I've had all my life. Then after being a picky eater at 40 plus, I had to change the way I eat as well as the way I treat my body by not exercising or eating right. These factors include stress, unhealthy foods, refined carbohydrates, no physical activity, not exercising, social isolation, and chemical pollution. Even though one may not suffer from all of the factors, but more prevalent in communities where there is a lack of jobs, less money, less education, and less social status, which leads to less of an access to healthy foods, as well as causing more barriers to more stress, more barriers to exercise, and often more exposure to chemicals. We're going to talk about in terms of economic, political, and ethical issues. Personally, I've had a hard time struggling with diabetes economically. The insurance that I previously had afforded me to be able to get my prescriptions filled and the proper care that I needed when I was first diagnosed with diabetes. Having any illness is costly, but it's more stressful and costlier when one can't afford to get the needed care of meds to treat diabetes. I started out on one prescription, which was covered by the insurance. After a year or so, the doctor added another medicine that was not covered by the insurance. I am thankful, though, for the insurance trial cards that some medicines give out to patients, or I would have not had the much needed medicine to treat my diabetes. So when I lost my job and the insurance changed to where I became a member of the Affordable Care Act, my regular prescription was available on the regular Affordable Care Act prescription list. But then when I went back to the doctor, my numbers were still not where they needed to be. So they changed my medication again. Well, as I stated earlier, I must say that I am the perfect example of what the political changes that have been made. How and what prescriptions one can get or can no longer get is a big part of that change and has always affected not only my health, but the health of many other Americans struggling with health issues. The future of the diabetes rate will rise if nothing more is done to educate, assist, and provide resources to more and more people where they can go to the doctor as well as afford their meds. The prevalence of diabetes will increase as well due to the need of more money allocated for the treatment, the education, and the assistance programs to get meds. Currently, there is more training programs on the rise, educational management sessions being provided, and just plain spreading the word on how to prevent diabetes, along with public awareness of what to do and what not to do to prevent diabetes. If you want to learn more about diabetes, please check out the American Diabetes Association website at www.diabetes.org or the Center for Disease Control and Prevention CDC website at www.cdc.gov/diabetes. I thank you for your time and listening to my video. Have a great day.